How about ADHD for VA disability cases? Is that something you get a disability for? Kinda, maybe. So, by definition, in terms of the DSM-5, the ADHD symptoms should have started, or at least, significant ADHD symptoms should have started before age 12, right? It used to be age 7 in DSM-4, before the DSM-5. And of course, the VA focuses on like DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition, right? In terms of diagnoses. Now, there are people that diagnose adult onset ADHD, like ADHD started as an adult, but that's not really recognized by DSM-5, to be honest. A lot of times with the adult onset ADHD, sometimes the people are really just targeting symptoms and saying, here's a medication, like a stimulant medication, ADHD medication that might help with those symptoms. Or, some people think, there can be an adult onset ADHD. Won't get too much into ADHD right now, but what's it like in terms of VA cases? I mean, concentration difficulties, focusing on things, trouble sitting still, inattentiveness, all of that stuff can go with lots of other diagnoses too, like depression, anxiety, PTSD. It can come from, it's not really a specific symptom. It can come from lots of different things. So it might not be ADHD. However, things from the military could also potentially aggravate or make ADHD worse if you were diagnosed with ADHD as a youth before the military. But really, the one issue sometimes that turns up is, let's say you are having concentration issues or something, and maybe you said ADHD or things like that. Or even it's one thing that a treatment provider put in the records in addition to PTSD, depression, anxiety, things like that, because they wanted to give you a specific medicine or something. Sometimes CMP examiners really narrow in on that and say, oh, well, this is ADHD. You've had this before the military. And, you really have to look. I mean, did you have ADHD treatment? Maybe you said you had problems in school or something. Was there a diagnosis when you even went in the military? Was there treatment for ADHD? Really? I mean, were you presumed whole when you went into the military and did okay until something happened in the military that changed? This is the one thing about ADHD with the VA disability cases. Sometimes, there really wasn't any real signs of ADHD until something happened in the military, or you know what I mean? And then you'll see a CMP examiner, over focus on a concentration concern, or you saying, oh, I had trouble in school or something like that, even though there was no real evidence of an ADHD diagnosis. Then they speculate, well, you just had ADHD, right? So that's ever an issue, we have to tease out whether that's realistic or not, whether it was, something that existed since before you were 12 and they just didn't happen to know when you went into the military, or, if the concentration issues, things like that are from lots of other things. So, thanks. Hey, you made it to the end of the video. Thank you. Here's the part where I'm supposed to beg you to click the like button, subscribe to the channel, and perhaps post a comment. But also, you can subscribe to my free email newsletter where I talk about my practice and my thoughts on things related to VA disability claims. You can subscribe to that on my website, nexusletters.com. And if a Nexus letter from a psychologist is something you or someone you know needs, you can get one from me at nexusletters.com. Thanks again. I think I did pretty good about not coming down overly hard on CMP examiners this time around when I really could have.